am Dr. Bharti Singh from Bharti Women and Child Clinic. A very warm good evening to all of you and thank you for joining us today. So, why this topic, heavy menstrual bleeding? Are you bleeding it right? So many questions come. This topic was chosen because nowadays we are seeing so many women coming to us with questions like, Doctor, I am not bleeding properly, or I am bleeding very heavily. And when you throw them the question back, since when this has been happening, their answer is, I have been bleeding for last 4 to 8 years. And what were you doing for those 4 to 8 years? No, doctor, I was very scared to come to a doctor because every time I have heard stories that if I go to a doctor, they might diagnose cancer for me, they might do an operation for me, and so many myths attached to it. So it has been happening with me very frequently, and how to take out this myth from the mind of our viewers, that's why we are here today. So this is going to be a session basically in English so that everyone understands us better, and if at all you are not able to understand or there are any queries, please put it in the comment section. We will answer you back. So starting with the basics, can send it to everyone, the link. So before starting with the basic topic, we have with us today Dr. Vidya Shri. She is a general practitioner. Please come, Dr. Vidya, have a seat. She is a general practitioner and very passionate about women's health, and she has been also receiving patients like this, and she was the one who came up with an idea that, ma'am, why not we just go and talk out to the people, and I thought Facebook and Insta will be the best way to do it. So welcome, Dr. Vidya.
Thank you.
I hope you have lots of questions for us and we will clear it all for you.
Thank you.
Okay.
Good evening, everyone.
Yeah. Dr. Vidya, want to talk something to our viewers?
I am Dr. Vidya Shri, practicing medicine for past 2 years, and specifically I have interest in gynecology and obstetrics, hence I am working on that, and I have been encountering many patients in my practice who come to us with heavy menstrual bleeding, with anxiously coming to us for a solution. Hence I had a talk with our ma'am, and we have come up with this live session to make you aware of all this.
Okay. So I think before starting with what is abnormal, we should know what is normal. Okay. So what are normal menstrual cycle? Women usually starts menstruating from the age of usually 14 years till 16 years, and they bleed up to 45 years to 50 years. Indian average is mostly nearly 45 years. Okay, so during this time, a normal cycle, what we consider is anything between 25 days to 35 days is considered normal. So this variation might be there. People should not panic about it. And if you bleed, some people from the starting of their menses bleed for 6 to 7 days. That is their normal. Some people bleed only 2 days. That is their normal. Okay. So usually we say 3 to 7 days of normal bleeding PV is considered okay for a patient who has been bleeding like this. But it becomes abnormal when a patient who has only 2 days of bleeding suddenly starts bleeding for 7 days. Or a patient who has been having 7 days of bleeding but now is passing clots. So all these things are considered normal, but as such, if you are having a pattern and that pattern is maintained, that means your periods are normal. You shouldn't panic, you shouldn't consult a doctor otherwise.
Okay, ma'am, then how you are going to label as heavy menstrual bleeding?
Yeah, so as we discussed now, a patient walks in. The first thing, if a patient is coming inside and coming with a worry of their bleeding, that itself shows that their bleeding is not normal. Okay, so that will be your first sign. Okay, the patient needs some attention in their bleeding period. So as such, heavy menstrual bleeding is anything which disturbs your lifestyle, as simple as that. If a patient has been bleeding only for 2 days and now suddenly she has started passing clots, or her periods have been more than 35 days, or she is bleeding within 25 days, or she is having bleeding every 15 days, all these are abnormal bleeding.
Okay.
A patient who bleeds within 15 to 20 days is not normal. They might be having polyp, they might be having so many other things.
Talking about polyp, what are the causes of heavy menstrual bleeding, ma'am?
Okay, the causes are many, To start with, hormonal imbalance, as simple as hormonal imbalance, could be the first and most common reason of having an abnormal bleeding. Okay, people usually, the moment they have heavy menstrual bleeding, they start thinking, overthinking. That's all, I'm going to have cancer now. That's all, I might have a fibroid. These all stories come from back. Okay, I would like to tell my viewers that not all heavy menstrual bleeding are cancers. Not all menstrual bleedings are fibroids. They are common, but not as common as heavy menstrual bleeding. 1 in 4 women suffer from an abnormal bleeding. They all don't need an operation, they just need an evaluation. So, the causes of heavy menstrual bleeding, coming back to it, the causes are hormonal imbalance, as simple as a change in patient's hormones, like abnormal thyroids, abnormal FSH LH levels, a rapid weight loss, a rapid weight gain can cause something called a central amenorrhea, which can cause abnormal bleeding, or you will not have bleeding. And things as simple as this can affect your cycle, so don't panic. And coming to something which is more than this, you can have polyps, you can have fibroids, you can have a thick endometrium, and you can have adenomyosis, and so many other things. So before going to what is this will be all Greek and Latin to the people. I would like to tell, Deepika, can you please pick up my phone? Okay. So I think this is visible. So this is your uterus. Uterus has got 3 layers. A normal layer which covers your uterus, another layer which is called the muscle layer, and another layer which is the endometrium layer. Now this endometrium layer, the innermost layer, forms every month under the influence of your hormones and bleeds. If there is any abnormality in this endometrial formation, then you might have 1 or 2 episodes of heavy menstrual bleeding. So, as you can see, there can be polyps. What are polyps? Usually this lining forms every month and comes out as menstrual bleeding. If because of some reason this lining is not adequately coming out, it forms a small mass inside, and that is called a polyp. And this polyp usually presents with continuous spotting PV for 15 to 20 days. Second thing which we see nowadays a lot is thick endometrium. So usually when a woman is menstruating, any endometrial thickening more than 14 mm, we should be worried. So it could be your hormonal imbalance which is reflecting on your endometrium, and we need to treat it. Okay. So the second cause would be your thickened endometrium. Now the third thing which we are seeing a lot nowadays is fibroids. So what are fibroids? Don't be scared. Fibroids are just an overgrowth of this muscle layer. Because of some genes in your body, this fibroids overgrow and form some mass, and this causes excessive bleeding. Also, more than the patient suffering, there is something in the something which has become a point of discussion for so many people: PCOS. Okay.
I was about to ask that.
Yeah, PCOS can also be a cause of heavy menstrual bleeding. Here I would like to also share with our viewers PCOS and PCOD. So many videos are there which tells PCOD is very severe and PCOS is very less severe. But in medical terms, the word PCOD has been taken out totally. There is only something which is called as PCOS. What means is polycystic ovarian syndrome. Syndrome means it is a collection of problems. It's a collection of symptoms and signs which together comes under PCOS. So there's nothing called severe, less severe, non-severe, PCOD. All those terms have been taken out. Okay. So this PCOS is again a hormonal disbalance, and this can come at any age. It's basically in your genes and can show out at any age. There is one very common entity which need not be treated. Some patients after delivery don't get periods for 6 months, and that's natural because they'll be feeding. But after that, sometimes when they get the first bout of bleeding, that bleeding might be heavy, but it's absolutely okay. So you shouldn't panic and come back to a doctor. Even if you come to us, we are not going to evaluate you much. We are going to go through your history and we are going to give you symptomatic treatment.
Okay, moving upon next question, ma'am. At what age the heavy menstrual bleeding you term is we need to be very cautious? At what age?
Any age heavy menstrual bleeding has its own diagnosis and we should take it seriously.
Okay. Is any specific at the age of 40s or something?
Commonly we see heavy menstrual bleeding occurring across 40. Like, lots of changes are 40 to 45. You see lots of patients coming with heavy menstrual bleeding. But this heavy menstrual bleeding can also occur in teenage, which is called as menorrhagia of teenage. And that menorrhagia of teenage, you need to just treat it symptomatically. And that's just because their ovaries are maturing and they are finding their maturity of the hormones and the hormonal imbalance, and then the bleeding just comes back to normal. So this teenage menorrhagia gives lots of anxiety to the parents. So I would like to tell all the parents that teenage menorrhagia most commonly occurs because the ovaries are trying to mature. Once the ovary starts producing eggs, that means the ovarian hormones have matured enough. You will automatically get to see that your bleeding is coming back to normal. But if you have in your house a kid having a heavy menstrual bleeding, please definitely come to the hospital and get it evaluated, because we do not want to miss out on certain things. Now coming to the age you were telling, every age patients can suffer from heavy menstrual bleeding, but then at every age the diagnosis is different. As simple as a missed pregnancy, not seeing properly and then going for abortion comes as a heavy menstrual bleeding for us. So sometimes the patients might not know that they are pregnant and they will come with a heavy bleeding one fine day and we find out, oh my god, they are having an abortion. So yeah, things like that have to be taken care of. Now coming to the most common age group where we see this heavy menstrual bleeding, it is the 40s. Okay, usually in 40s the body goes for a reset of hormones. So this reset of hormones might show you as an irregular period or a change in your cycle or a heavy bleeding. Most common cause of bleeding during this time is again a hormonal imbalance, followed by these fibroids, polyps, adenomyosis. In India especially, if a patient is suffering from a heavy menstrual bleeding associated with clots, associated with pain, they could be associated with something called as adenomyosis or fibroids, which if found out early are very much treatable with medications.
Hearing about the facts of heavy menstrual bleeding, let's move on to breaking the myths.
Okay.
The first one is, what does papaya causes heavy bleeding?
Okay. There are so many patients who will take papaya if they have not got your periods. They want to go to temple, so they try papaya and then they come to us that we even ate papaya and it is not happening. Now what to do, ma'am? So I am not against papaya, but I have a scientific reason to tell you that how papayas can work. So papaya has an enzyme called papain, and this papain can cause an increase in your estrogen level, that is one of the hormones in your body, and that can cause a bleeding. Okay, but this papain enzyme is only present in an unripe papaya. So ripe papayas will not have that much of papain, and it absolutely will not give you a withdrawal bleeding. So yeah, papayas, if they have that papain, can add to your irregular periods and heavy menstrual bleeding sometimes, but not 100% correct.
Okay, ma'am. Then patients used to refuse us antibiotics so that they'll get heavy menstrual bleeding.
Okay. If you want to put it in a very scientific way, some patients have a course of antibiotics, and the coming month either they miss their periods or they have a heavy menstrual bleeding, and they correlate it to antibiotics. It's not totally wrong. It's not the antibiotics which cause it. It's any kind of mental or physical stress which your body undergoes can directly affect your cycles. So it's the disease you were suffering because of which you took antibiotic, which would have caused a physical stress for you, and that physical stress can lead to an irregular period or a heavy menstrual bleeding. But rest assured, if you have something like this, it will get okay by itself. You need not worry.
Nowadays we come across fastings and intermittent fasting mainly. Does it causes heavy menstrual bleeding?
Intermittent fasting, if done properly under guidance, will not cause any kind of physical stress to the patient. Some people overdo it, and that is the time where they go for central amenorrhea. That means the hormones in your brain start changing their ways of secretion, and that is the point where you can have your irregular periods. I am not telling that intermittent fasting is bad, but I am telling you to do it under a proper guidance so that it does not affect your body.
And
at the same time, I would also like to interfere you. People after taking COVID vaccine had menorrhagia. See, studies are still going on whether it is directly related to heavy menstrual bleeding or not. But as we told, if you want a scientific reason behind it, the only possible scientific reason could be a kind of physical stress which your body has undergone, which would have reset your hormones. So if at all it happened, it is just a transient episode, and your cycles will come back to normal after that.
Many patients come to us asking us, I have heavy menstrual bleeding, ma'am, so I have cancer. Do you remove my uterus? So what do you
So yeah, once the patient is telling that they have a heavy menstrual bleeding, what will you do first? Okay, if right now you're sitting at home and you feel that you are having you are suffering from this, what we are talking about, visit your doctor. If you have heavy bleeding, visit your doctor. Your doctor will see you, take a proper history of you, and then examine you and find out the reason of heavy menstrual bleeding. If you are really suffering from heavy menstrual bleeding, then your doctor might do some blood test and might do a scan, which is very important. Most of the patients with heavy menstrual bleeding will have a scan, and you will be first treated only with symptomatic medications and lifestyle modification. Only if you have some issues with your blood investigations and scan, your doctor might go further and do some extra testing.
Okay. Then last about breaking the myths, patient ask us that do you prescribe us medicine throughout the life for heavy menstrual bleeding?
Okay. It again depends upon the cause of heavy menstrual bleeding. So, if the cause of heavy menstrual bleeding is a fibroid, and if it is a small fibroid, we give you intermittent medications and it gets okay, and then we just follow you up. If your cause of bleeding is a polyp, then we again try to treat it with medicines first, and then if it's not okay, then we might have to take out. Okay. Now, with the fear that you will end up in a surgery, you should not complicate yourself. What I mean to say is, please come early to your doctor so that they actually are able to find out a cause at a very early stage. Because if we find out a cause at a very early stage, there are lots and lots of medicines which can be given and can treat your heavy menstrual bleeding. This heavy menstrual bleeding most of the time is a transient episode, and if we treat you properly at the right time, this will not come back. At this point, there is a word of caution which I would like to use for patients whose bleeding has stopped for 1 year. That means they have entered menopause and then they have again started bleeding. Anyone in your known, if you have anyone like this, please tell them to go to their gynec and get themselves checked. Once you stop bleeding, it is always abnormal that you bleed again. You are bleeding again because your body has restarted producing hormones, and that's not good for your uterus. So in that case, we do a scan for you. Even one single episode, we do a scan for you and we find out what is the cause. So as we discuss about this lining, if this lining is more than 4 mm in a patient with menopause and having a bleeding which is called as a post-menopausal bleeding, this patient, if the endometrium is more than 4 mm, we go for something called as biopsy. What is biopsy? Simple words, just take this tissue and send it for testing. Okay, so olden times people used to give anesthesia, do cleaning and then send it for biopsy. Now it's not a tedious procedure. It's a very simple procedure. It's an OPD procedure. You come to our OPD, we find that the endometrium is more than 4 mm. We just insert this. It's almost, as you can see, it's hardly 1 mm and flexible. This goes inside your uterus. This goes inside your uterus, and through suction, we just take this this layer and send it for biopsy. It's the 5 minutes procedure and it's a life-saving procedure. This is called as pipple biopsy. This is called a pipple. So pipple biopsies are very, very, very important and very, very innovative, and if your doctor has advised you to take one, please don't hesitate and go ahead and do it.
So far we have talked about facts and myths, and just coming to as a physician out there to help us, in a primary level care, how a physician should approach a patient with a heavy menstrual bleeding?
Yeah, sometimes the patients, the first time a patient sees is a physician. Only then the physician sends the patient to the specialist. So once you see a patient, treat them symptomatically. Treat them symptomatically. First treat their worries. First treat their symptoms so that they are comfortable. So they are bleeding, stop their bleeding with, there are so many medications in market. Then do the basic blood investigations. In those blood investigations, you can go for thyroids, prolactin levels, hemoglobin level, and check the patient, check the history of the patient, find out if there is any history of any fibroids in the past, polyps in the past, any abortions happening in the past, some history which gives you a clue that why this heavy menstrual bleeding is happening. And then if you find there is no, most of the time there is no cause, then what do? That is the question. So when there is no cause, just treat them symptomatically and follow them every 6 months. Sometimes the causes take some time to come out. So follow them every 6 months, and if at all you find something suspicious, send it to a gynec. That's all. So just 2 or 3 medicines in a day will treat the patient and they will be all back to normal.
And second thing is, what are the patients face problematic when they don't come to a doctor at the right time?
Yeah, okay. If the patients don't want to come to a doctor, what is happening? their quality of life decreases. Their quality of life decreases. A woman in India does not have the luxury of most of the women in India does not have the luxury of sitting and just enjoying a day when they are feeling low. No, we are burdened with so many responsibilities that even you're bleeding heavily, you need to work. You need to still send your kids to school. You need to still cook. You need to still do so many works. Okay, so and if you bleed like 10 days, 15 days a month, the first month people might help you. The second month the family might be supportive, but the third month they'll be like, okay, this is a monthly affair for her. You have to come up and cope up with it. So don't do that. See a doctor, treat yourself, and go. For the fear of something is going to grow big, not coming to a doctor is not a right decision. Second thing is, if you keep on bleeding like this, what is going to happen to your hemoglobin level? You're going to drop your hemoglobin level, and you will develop full-fledged anemia, and that anemia itself has so many complications. I have seen so many patients who come to us and just tell मैडम जी हमको तो 4 साल से है bleeding, 5 साल से है bleeding, and you just check them, they are pale, their hemoglobin is 4, 5, and the patient very proudly tells it also. हाँ 3 साल से हमारा hemoglobin 4 है. How are they surviving? For the last 3 years, a hemoglobin of 4, how much damage it could have caused to their body? How long they are going to live with all this? So quality of life is the most important thing. Anemia, and then as such, if you close your eyes, your problems won't solve. If you do not treat your heavy menstrual bleeding, don't think God is going to come and treat it for you. If you have a fibroid, it is going to grow. If you have a polyp, it's going to grow. If you have adenomyosis, it's going to grow. And then it's just going to add up to your problems, and that's a point where the doctor is also helpless and have to go for radical decisions like going for a hysterectomy, going for uterus removal. So all those things should be kept in mind.
Okay. Then I had a patient coming to me that ma'am, I am bleeding for past 10 days, past 10 to 15 days. Do a curate for me, so I'll get relief from my symptoms. Do we need the curate, ma'am? Why is the patient is very popular about asking curate?
Dilatation and curettage, like what you call in local terms DNC.
Yeah.
In olden days, when these scans and blood tests weren't there, the only treatment the doctor has was any patient coming off with heavy menstrual bleeding, remove this lining. The removal of this lining is called as DNC. Nowadays, with all these high-tech investigations in our pocket, we hardly go for anyone having a dilatation and curettage. You have better medications for that. You need to find out a cause for it. You can find out a cause for it. So absolutely not necessary. And DNC will not relieve you of the bleeding. It might relieve you of the bleeding at that month. But what about the underlying problem, which is increasing that lining every month? So treat the cause, and you will be treated automatically.
Okay, it was very nice, informative. And last, ma'am, what is the relation between a pap smear in patients with heavy menstrual bleeding?
Okay, let's talk about pap smear a bit. So what is a pap smear? Uterus, the opening of the uterus is called as cervix. Cervix is very prone to develop cancers because it is very prone to develop infection. So it's a viral infection which can convert it into a cancer over a period of time. So to find that out, we do a pap smear. Okay. So as such, pap smear and heavy menstrual bleeding are not related. But whenever you go to a doctor, they will always advise you to take a pap smear if you are not bleeding. Deepika, door close pannireenga. So whenever you we were talking about pap smear. So pap smear is to diagnose if you have any cervical cancer. Any cancer of the mouth of the uterus can be detected by pap smear. Also, patients who have some growth at the mouth of the cervix can present with heavy menstrual bleeding. So in that case also pap smears might help. But we do not take a pap smear, we cannot take a pap smear if you are bleeding. So if you are planning to have a pap smear with your gynec, go when you are not bleeding.
That's about the questions from my side.
Okay, since we are talking about heavy menstrual bleeding, we cannot finish this talk before talking about something called as Mirena.
Yeah,
right?
Absolutely.
Okay, so what is Mirena? Mirena looks exactly like copper tea. It has some medicine in it, which is a progesterone medicine. So what do we do? Most of the time this lining is abnormal because of abnormal progesterone levels. And if we give progesterone, this lining dries out. So in a very simple language, whenever you use progesterone, this lining dries out. So if your lining dries out, your problem is solved. The switch of the uterus is off. That's how I explain to my patients that if your uterus is bleeding abnormally, give it some rest, switch off the uterus. And how do we do that? We can do it by giving oral medicines, or we can do it by putting Mirena. Oral medicines, you take 10 milligram of medicine, it will go to your liver, your kidney sometimes, and then go to your uterus and then works. How long you are going to take it? 3 months, 6 months, you will miss it one day and the next day you bleed. It's very difficult. Practically speaking, it's very difficult. So the same medicine is put in the Mirena, which goes directly into the uterus and dries off this lining. So you need not take the medicine daily. The same effect is happening, and this Mirena works for 5 years. If you want to have a pregnancy, remove the Mirena and the next cycle plan. So this is how Mirena works. Mirena is a wonderful innovation. We have totally shifted to Mirena. Earlier we used to do 10 hysterectomies for the same problem. Now we put 10 Mirenas. It is that comfortable for the patient. No admissions required. It's a very comfortable procedure. Patient will be very comfortable with it. They carry on with their life. There is no rest involved. There is no cut involved. There is no surgery involved, and it solves all your issue. And most of the time when I tell my patients, we are going to put Mirena, it's going to stop your bleeding, they come with the doubt, oh my god, then everything will get accumulated in my uterus, and what will happen to that bleeding? So I just tell them, there is no input, there is no output. So the bleeding is not formed, the bleeding is not coming. You have switched off the uterus. We have attained a stage where without doing a hysterectomy, we can bring in the effects of uterus removal. Okay. So this is about Mirena. I think we have covered most of the questions about heavy menstrual bleeding. If our viewers have any more doubts, they can always ping us, and if they live nearby, they can drop in and meet me or Dr. Vidya anytime for any of your queries. Take care of your health, stay healthy, stay happy. Bye.